So yeah, for the rest couple an hour now, maybe it's not an hour, it's really 50 minutes. We're gonna have the AMR hour, aka antimicrobial resistance hour. And I have actually lined up two speakers for you. We have Hui-min Neoh from the National University of Malaysia and Victorien Dougnon, who is from Benin, Africa, from the University of Abomey-calavi in Benin. So I'll just admit them into the room, and we can slowly start the discussion. Hello, Hui-min, Victorien, can you hear us? I guess you have to unmute yourself.
Yes, I hear you
Hi.
perfectly. Hi.
How are you guys?
I'm fine.
It's
And
just so
you?
wonderful that we're able to join here today from three different parts of the world, quite far away from each other, which is fascinating. But yeah, I was just saying to everybody that Victorien, you're from Africa, and Hui-min, you're from Malaysia. So we have two very different, interesting aspects to discuss, and you guys bring all the experience that you have from the field, as I understand. So how the session will go, I have a 10-minute short presentation just to give you like a bit of essentials, let's say, into some terms that we need to know before going into the presentations. And then Hui-min, I will hand over to you to give us your presentation on what happens if there are no antibiotics. And then Victorien, you're gonna have the stage next to tell us how scientists could contribute and your experience in West Africa, right? So I guess we're all in the same page with that. I'm not sure if Victorien, you want to go first because you have to. I remember you said you are in the field right now at the moment. So if you prefer to go first, that's absolutely no problem.
Oh, it doesn't matter. I can go first and go second.
Okay,
Not a
right.
problem.
Okay, we'll keep the original schedule then. Okay. So I'm just gonna share my screen. So yeah, as we said, we have now joined into the antimicrobial resistance AMR hour, and we're going to walk you through in terms of what is antimicrobial resistance, what are antibiotics, what you can do, what scientists can do, what you can do from home, and how we can all contribute into preventing this global threat, as you will see in just a moment. So I just want to say hi to all my colleagues down in Sheffield, which I have done my studies there in antimicrobial resistance. And yeah, I'm just going to go to my first slide, which is just a recap. So what are antimicrobials? So antimicrobials are, in simple terms, medicines. They are used to prevent and treat infections in humans, animals, and plants. And these can be different types of antimicrobials. And this is quite an important term. So we have antibiotics, which work only for bacteria, antivirals, which work for viruses, antifungals for fungi, and antiparasitics for parasites. And this is quite an important distinction to make here because there's the misconception, you can use antibiotics to treat common flu, right? Which is, I think for me, it's the number one reason that people think, okay, I have the flu, I'm going to go to my doctor and ask him or her to give me some antibiotics. But, antibiotics do not work against viruses. They only work against bacteria. So if you have the common cold or the flu, they don't help. So next, antimicrobial resistance. So this is quite a big term, which I will try to simplify for you guys. So it occurs when all these microbes, bacteria, viruses, fungi, parasites, they change over time and they do not longer respond to the medicines. This means that the infection still continues to be there. It is harder to treat. The risk of the disease spread is more, as we can see, with, let's say, coronavirus. when one person gets infected and is not treated, it transmits the disease to more and more people. And this is the case with antimicrobial resistance. If a drug doesn't work, the infection remains and the spread continues. And this leads to severe illness and unfortunately sometimes death. So yeah, as a result of drug resistance, the medicines that we have become ineffective, infections become difficult to treat or impossible to treat in some cases. And I just want to mention here that the term superbugs, so microbes can be resistant to one type of antibiotic, to more than one type, 2 or 3, to the different classes of antibiotics. So, you know, the issue kind of extends into multiple dimensions. So, for example, if we say I have an infection and I need to take antibiotic A, this doesn't work. Okay, what the doctor will say, okay, we'll take antibiotic B. But if antibiotic B doesn't work because we have resistant bacteria, then, you know, there's no antibiotics and no cure, there's no treatment. So this is kind of the struggle that we have right now into the issue of antimicrobial resistance. And just a short disclaimer that there are just many mechanisms that microbes use to become antimicrobial resistant. We're not going to touch on those in this lecture. We're just going to just generally talk about the issue. But just so you know, there are different mechanisms that bacteria, viruses, fungi, etc. can become resistant. So, I guess I wanted also to mention where are antimicrobials used, so we can understand the impact of antimicrobial resistance. So we need to understand where antimicrobials are used. So as you all know, I guess the most known use is in medicine, so to prevent or treat infections. And in terms of prevention, for example, you get a bite and you take antimicrobials to prevent you having an infection. Treatment, that's straightforward. Also, we take antimicrobials to enable us to do some types of surgery. For example, in C-sections, in hip replacement, in organ transplants, antimicrobials are really essential to enable us to carry out these practices safely. And of course, antimicrobials are used in some medical conditions where when people are vulnerable to infections. For example, people that receive chemotherapy treatment for cancer. The second place where antimicrobials are used sometimes is for domestic use. So again, here to kill harmful bacteria, for example, sometimes in our soap, shampoo, cleaning products. But I think for me, kind of the most striking example of antimicrobials is in animal agriculture. So not only for humans, but also in animals. And here again, to treat sick animals, to prevent diseases. But also antimicrobials are or were used in growth promotion. So I just included a nice illustration here that shows the chicken sizes over different years, just to understand, you know, in 1957, the chicken was very small and tiny, and then because we're using antimicrobials to increase growth and make chickens bigger faster, we tend up in 2005 and even now having like very fat chickens because antimicrobials are used. And also, we're moving on to antimicrobials used in other agricultural purposes. For example, horticulture, which refers to the use in plants. So for me, I guess the most striking example for me is here, this picture, the nice colorful picture in tulip production. So antibiotics, sometimes antibiotics that we use for human infections, they're used for plants, animals, and also in this case, tulips. And another thing is aquaculture, meaning fish, aka fish farming. So in this case, as you can see in this picture, it shows salmon farming. So imagine having big tanks of fish in the middle of the sea, and you grow all of them. They're very close together. The population is high, and antimicrobials are used to treat infections, prevent infections, but also because of the high population, the animals get stressed. The fish get stressed, so they're more susceptible to get an infection, and therefore we need to use antimicrobials to allow them to grow naturally and not die. So in brief, these are where antimicrobials are used. So why is antimicrobial resistance a global concern? So the World Health Organization, they have antimicrobial resistance as the top 10 global public health threats facing humanity. And this has multiple dimensions. And as you understand, it has dimensions in animals, humans, plants, climate change, food production. It's not just something that affects hospitals, as somebody might think of. So it's a threat to treat common infections. But it's also a problem. Oh, yeah, I need to refer to this map first. As we said, it's threat to common infections, and the statistics say that if we continue to do what we do now, until 2015, the deaths from antimicrobial resistance will be more than the deaths from cancer. So it's really, really an important issue that we need to pay attention to. And coupled to antimicrobial resistance, the problems is even more. So you might say, okay, antimicrobial A doesn't work, antimicrobial B doesn't work. Okay, why don't we go and find new antibiotics, antivirals? But unfortunately, the pipeline that we have now of new antimicrobials, it's dry. We had a huge production line, let's say, of antimicrobials peaking in the 1950s and 60s. But now, as you can see in this graph, here at the bottom, there are zero or very few antibiotics from 1990s onwards. So this is a huge problem. The governments and all the pharmaceutical industries are, putting a lot of effort in finding new antimicrobials, but it's just very difficult to find new ones. So this again shows how important it is to preserve the value and the effectiveness of what we have now. And last but not least, there is an economic cost that couples with antimicrobial resistance, both in the governments, also personal economic cost. You need to buy antibiotics constantly because it doesn't work and stuff like that. There's a cost for the hospitals because if it takes longer to treat an infection, it means that, you have to have the patient for longer. It also prevents other new patients coming into the hospital. So it's kind of a multidimensional problem that I hope I was able to convince you guys in this short 10 minutes. So this brings me to the end of my presentation. And I will hand over to Hui-min now. You have a presentation ready? Should we check if you can share your screen and everything works well? But I just want to say to everyone, if you have any questions, we are monitoring our social media and YouTube channels, and we'll answer those at the end of the session.
Can you see my screen?
Yeah, perfect.
Right. So shall I start?
Yeah, go for it.
All right. Okay. Right. So we'll get the pointer ready. Right. So thank you so much, Eleni, and hello, Victorien. Hello, everyone. Good morning, good afternoon, good evening. And thank you so much for joining us on this AMR hour in this International Microorganism Day. Thank you so much to FEMS for having me here today. My name is Hui-min, as introduced by Eleni, and I'm from the National University of Malaysia. Right. So for this session, I would like to take you along with me to ponder this question. So what happens when there are no more antibiotics? Before I start, allow me to give a brief introduction about myself. I'm an associate professor and senior fellow at the National University of Malaysia. I work with antibiotic-resistant bacteria together with my AMR detectives. Right, these are my students and my staff together. What we do is we determine antibiotic-resistant mechanisms in bacteria isolated from patients from our university hospital. And we also do some detective work by tracking the antibiotic-resistant genes in the bacteria isolated from our hospital using DNA technology. Right, so what happens when there are no more antibiotics? Have you ever give a thought about this question? And do we realize that we might be actually having a second pandemic happening right under our nose, which is the silent pandemic of antimicrobial resistance? Right, as Eleni mentioned just now, right, antibiotics are medicines that target bacteria only, right? So they target the cellular components or cellular processes of bacteria, right? Well, antibiotics are not new concepts, right? Ancient civilizations such as the Egyptians, the Indians and Chinese civilizations have used food ingredients such as honey, turmeric, even grape molds, to put it on, to apply on their wounds and cuts. And what they didn't know at that time was that it was actually the active compounds inside these food ingredients that killed the bacteria, right? So it was until 1928 where Sir Alexander Fleming discovered penicillin, right? And also a team from Oxford, I think Dr. Florey, Italy, and also Chain, that purified and commercialized penicillin for clinical use, right? So after the discovery of penicillin, humanity welcomed what we call the golden era of antibiotic discovery. Right? You can see that from the 1930s onwards, many different classes of antibiotics were discovered and commercialized for clinical use. And such was this amazing miracle of antibiotics that the deaths from infectious diseases start to show a downward trend, right? And some people even said that, okay, we are already after, the era where we face the threat of dying from infectious diseases. However, we know that that didn't happen. Well, you may ask why. Antibiotics are not like our usual medicine. They work on bacteria. They do not work on human cells. So what happens when we take antibiotics? Like exposure to antibiotics, right? It will happen, something will happen like this, what this comic is showing, right? But Timmy, you have to eat your antibiotics or you'll never become a big, strong bacteria. So exposure, any type of exposure to antibiotics, especially in long durations, will teach the bacterial cells, right, to become resistant to the killing effect of the antibiotic itself. And that antibiotic resistance in bacteria, it's a common, it's a natural phenomenon. But we humans are speeding up this learning process of this bacteria by misusing it, as what Batman is trying to tell Robin, like we shouldn't be using antibiotics for common cold, mentioned by Eleni just now, and not using it for viral diseases. Right, and also I can picture Eleni's figure just now of the chickens, right? So antibiotics have been used in livestock farming, and I think it's because of that that we start to have enough food, surplus food for the world global community. But the thing is, when we give antibiotics to livestock, right? Similarly, in humans, antibiotics will kill most bacteria, right? But which is might be causing infections in this livestock. But resistant bacteria will survive and multiply. And when this resistant bacteria spreads to animal products, right, and also in the environment, right, and when we humans come into contact with contaminated food or contaminated environment, we will get antibiotic-resistant infections, and there might be some treatment difficulties faced. Right. So some of us may be thinking, right, we have so many types of antibiotics, right? So what if antibiotics are being used in livestock, and what if some of us have used antibiotics for a common cold? We have so many on in the cabinet, but there's a development void in the antibiotic industry, right, after the 1970s. And yes, the antibiotic cabinet is getting empty, as you can see from here, from the 1980s until now. Right, the numbers of antibiotic getting approved for clinical use is becoming less and less by the year. And in fact, analysis shows that there's this continued deficiency in the antibiotic pipeline since 2014. Right. So on one hand, you have bacteria learning to become resistant, and us helping them in this, this fast-track learning, right? And on the other hand, the antibiotic cabinet is running empty. So what will happen one day, right, when there are no more efficacious antibiotics to be used? Right, these are very three pictures that shows basic medical procedures, right? Childbirth, right? Especially like cesarean section childbirth, we will need antibiotics, right, to prevent infections. You will have, for some of you who are going into your teens, or even some adults might have to go for wisdom tooth extraction. And yeah, if you have been to wisdom tooth extraction, you will know that you will definitely be prescribed what we call prophylactic antibiotics, so to prevent getting infections from oral bacteria from the wound after tooth extractions, right? And yeah, simple surgeries to complex surgeries, simple surgeries like appendectomy to complex, heart transplants. Everything depends on us having this safety net of antibiotics, right? And yeah, it's kind of like an insurance, or as what Rex and Otterson describe antibiotics, they are this fire extinguishers of medicine, right? So, if you're in a building, it will be great, regardless if you have a fire or not, the fire extinguishers have to be there, right? You don't want to, buy an extinguisher when you have a fire. Like same case with antibiotics, right? You might not be using them, there might not be acute infections yet, but all the while we need to have them on standby, right? Especially when we have procedures that will inflict wounds, right? And injuries. So antibiotics are our safety net, and without them, basic medical procedures will become high risk once more, right? So before you have a child of your own, you might want to think twice, if you want to really have this child or not, because it might become life-threatening again, right? And having no antibiotics, right, will undermine all the these miracles of modern medicine. And perhaps also this this downward trend of infectious diseases will again show an upward trend, because when antibiotics do not work anymore, right, infection will become the main killer once again. Now, is that all? Well, we can take a clue from the COVID pandemic, right? So when you do not have this antibiotic safety net, will you, let your kids go to school, commute to school with a peace of mind? Right, so kids will be kids, right? So when they get to school, they will climb trees, they will chase after one another, then they will fall down, right? They'll get hurt maybe from using the scissors or pen knives during art class, right? So all these injuries might not be life-threatening, but it would be nice to have antibiotics around, just in case if the injuries turn lethal, right? So if we do not have antibiotics anymore in this world, can we let our kids go safely to school? Will lockdowns, be the solution until antibiotics are found, right? New antibiotics are found, or another solution are found for injuries. And that's not just for, school children, right? So what about adults, right? So when we go to commute to work, this is not just about, the risk of having car crash or when we commute to work. So if you're involved in a car crash and there's no antibiotics, of course, that is really deadly That's definitely deadly. But for some professions such as butchers, hairdressers, right, construction workers, where they handle machinery or equipment that can inflict injury or wounds, right, in their profession itself. So without antibiotics, these people will have a very dangerous occupation indeed, right? And then you might have less people doing that, and when work is affected, as we take a cue from the COVID pandemic, right, there will be economic hardship, right? There might be poverty and also hunger in cases of individuals or societies that are deeply affected by it. And when we talk about hunger, right? So Eleni's picture of chickens come into mind again, right? So when antibiotics do not work anymore, right? So when you do not have antibiotics anymore, are we ready for farming without antibiotics, right? Will we have enough food supplies for the whole global community? And I'll be asking maybe some dark questions. So when the antibiotic cabinet gets emptier and emptier, now who will actually get the limited supply of antibiotics? Will there be this hoarding of antibiotics by richest individuals? Right? Will there be antibiotic black markets? Right? And then if we consider this antibiotic-resistant AMR in the context of these United Nations Sustainable Development Goals, we can see that, without antibiotics, there will be this domino effect, right? We'll not have good health, education will be disrupted, there will be poverty, economic hardship, there will be hunger, right? And of course, there will be societal inequalities. So, are you ready for this dystopia of a post-antibiotic era, right? So where our children, where the kids cannot go out and play freely as they want to? Will we have phobia when handling sharp utensils, such as when you're preparing, cutting that onion for your family, cooking dinner? Will we have phobia because knife injuries might become life-threatening once again, right? Will you be willing to commute on the crowded trains if you have no antibiotics, knowing that okay, maybe some passengers in the train have, I don't know, antibiotic-resistant strep throat, antibiotic-resistant, right? And then, what about leisure activities, right? Like we Malaysians, we like to go for picnics during the weekend, and we have this what we call the leptospirosis risk, right, by the leptospira bacteria, right, in areas, in waterfall areas. So can we, go to enjoy ourselves during the weekend again, or travel to have exotic foods, just enjoy this simple day-to-day activities when there are no more antibiotics? Right, and it has been imagined by several authors about this post-antibiotic apocalypse. If you're interested, you can read more about the stories about this in this Infectious Futures book by the Longitude Prize. You can download it freely. And there's also this comic Antibiotic Tales by Dr. Shu from Singapore. And the weekend is coming, so you can watch this short film, Catch. This is about a fictional short film about the father and daughter who is trapped in their house in this post-antibiotic world. Right, so you can view this at your leisure. Right, so these are not dystopian, this kind of dystopian description of no antibiotics are actually not as far off, right? So because we do have reports of untreatable infections in newborns, right? Drug-resistant E. coli found in patients, right? And what we mentioned just now, right? Antibiotic-resistant bacteria in livestock, but you do have pet store puppies passing drug-resistant bacteria to people, right? And with this this photo gave me a very, very strong impression, right? This patient, TB patient in Mumbai, like look at her drawer or her cabinet of injectable antibiotics for tuberculosis. What if one day this antibiotics do not work anymore? What will happen to her, and what will happen to us, right? So well, with COVID deaths, we know that until yesterday there was about 4.6 million deaths, But who is really monitoring deaths due to AMR? How is the actual magnitude? Does anybody know that, right? Because the situation of AMR is like what the UK AMR envoy, Prof. Sally Davies, described, right? As this, it's this winter and this frog found this pot of boiling, not boiling water, but it's just water which has been put onto the stove. So it's sort of like warm and nice. And like it's kind of like us, we feel that, okay, there's still antibiotics in the cabinet, or maybe a lot of people are not aware about this problem of antibiotic resistance at all. So, but as the clock ticks, right, the boiling point of the water is, coming nearer and nearer, and this silent pandemic can become full blown, right, into a big pandemic that like what we have now in COVID. So, what can be done? Right, so we can help to prevent this silent pandemic, right? Slow motion pandemic by taking care, not to fall sick, right? Because when we take care of ourselves by good hygiene and preventing ourselves from becoming sick, we reduce the exposure, the risk of taking antibiotics and the exposure towards antibiotics towards our gut, our normal flora, right? And never ever share antibiotics, be it with your spouse, your kids, your family, your friends, because we never know if you're having, the same type of bacterial infection, right? So never share antibiotics, and always seek the advice of a qualified healthcare professional before taking antibiotics. In Malaysia, we cannot buy antibiotics over the counter. We need to have a doctor's prescription. So do follow the regulations, like in the country you're staying before, getting antibiotics, right? And we can really help that man a favor, doing him a favor, right, by not taking antibiotics for viral diseases such as common cold, flu. You don't take it for COVID, right? Right. And then if you want to go the extra mile, right, you can shop for antibiotic-free meats, poultry, right? Because consumer demands will most probably drive changes in the livestock industry, right? So perhaps, when you go for shopping for groceries this weekend, look out for if there are any antibiotic-free options, right? This one is from the supermarket in Malaysia, right? Lacto chicken, antibiotic-free chicken, right? And I think what we can do from today onwards, right? We do not need to be, scientists or in the antibiotic industry to, design new antibiotics. Of course, that is important, but as public, a member of the ordinary public, we can tell someone, who you meet later for your breakfast, lunch, just tell someone how important antibiotics are, right? So the WHO designates the World Antimicrobial Awareness Week in the 18th to 24th November of every year. So spread awareness and stop resistance. Well, you do not have to wait until this week to tell people about, the importance of antibiotics. Because if we do nothing now, if we stay complacent, we will be like this frog here, right? And you don't want it to become a full-blown endemic of, no antibiotics to use, where all the stories from this post-antibiotic era will become a reality, right? So we should jump while we still have the strength, right? So tell someone how important antibiotics are, right? Stay ahead of the AMR curve. Let us all play our role to prevent the AMR slow motion pandemic together. I think that is my last slide. So back to you, Eleni. Thank you very much for being with me.
Thank you, Hui-min. That was a wonderful presentation. I mean, I myself get a little bit too excited when we talk about antimicrobial resistance, because it was a subject that I truly think we need to pay attention to. Thanks very much. We'll pass quickly to Victorien if you're there, I guess. If you can unmute your microphone and show the video. Yeah, wonderful presentation, and we'll have a few questions at the end.
Thank you very much.
Great.
Thank you, me, Eleni, and Ben. Thank you, the participant. I'm Victorien Dougnon. I'm a senior lecturer in microbiology in Abomey-calavi. It's in Benin. So I'm here with some of my colleagues working on rats, different rats. So it's my pleasure to talk today about antimicrobial resistance in West Africa and how scientists could contribute to this fight. As you may know, antimicrobial resistance is now a big issue in Africa and also worldwide. So the outline of my presentation, we start by a global health challenge, that is the AMR, and what is the situation and challenges of AMR in West Africa. And of course, I will talk a little bit about what we are doing in Benin, especially with my team. And finally, how to improve the situation of AMR in West Africa and Benin, also parts of this continent. AMR as a global health challenge. You know, the antimicrobials really help in the management of infectious diseases in the past. It reduced the mortality, but the antimicrobial resistance will occur when bacteria, when parasites, when viruses or fungi will change the situation and protect themselves from the effect of antimicrobial drugs that were designed to destroy them. And antimicrobial resistance is getting increasing global threat to human health. And a very huge number of people die from infection caused by the bacteria, especially resistant to antimicrobial each year. And from a report, the ONEL report, they estimate that by 2050, we will have annually 10 million deaths of this phenomenon. From the World Health Organization, AMR is then a global health and development threat, and it's one of the top 10 global public health threats facing humanity. So we have this, I need to open to have my pointer. Let me check quickly. Not really, I don't find it. Okay, so we have these antibiotics, antiviral, antifungals, and antiparasitic that are among all these antimicrobial. So this is an example of how antibiotic resistance can spread. You see, here we have the animals that get antibiotics and develop bacteria in their guts. And then humans, represented by this man, George, he gets the antibiotics and develop also the resistant bacteria in his guts. And finally, the drug resistant bacteria will remain in the meat from animals. And when that meat is not handled or cooked properly, the bacteria will then spread the bacteria will be spread to humans. And from the same way, when George will get care at a hospital or nursing home or other inpatient care facility, the resistance germs will spread directly to other patients or indirectly on unclean hands of healthcare provider. And this phenomenon is really, really frequent in Africa, where healthcare provider does not follow exactly what should be done. And the resistant bacteria will spread to other patients from surfaces within the healthcare facility. The patient will go home with those resistant bacteria, and from the animals, the fertilizer or water containing animal feces and drug-resistant bacteria will be used on food crops. So this is how the drug-resistant bacteria will disseminate in the environment. That's why it's a very huge battle, because it's not only one component, it's the whole component, the health, environment, agriculture, everybody is very concerned by this fight. What is the situation and challenges of AMR in West Africa? Significant resistance was reported for several bacteria in hospital and also in the community. And Africa is very vulnerable to the consequence of rapid evolution of AMR due to the poverty, due to the inadequacy of healthcare and sanitation infrastructure, due to poor nutrition, and also due to adverse climatic factors. The challenges are that related to education, we don't have enough educated experts to tackle the AMR challenge. The poor quality of AMR-related scientific data, and also the weakness in antimicrobial susceptibility testing in many countries have been also identified as a big challenge. We have also some problem about the data collection. In many countries in Africa, we have the absence of a national surveillance center that could collect, analyze data on AMR in real time, and suggest some corrective way to change or to solve the problem. We also have some big challenges about the surveillance. The laboratory capacities and research infrastructure are under-resourced. The surveillance of drug resistance is carried out in only a few countries. And also, there is a scarcity of accurate and reliable data on AMR in general, and especially on antibiotic resistance in particular, for many common and serious infections. This was a part of the World Organization of Health reports. Now, what the situation about the research in Benin? Benin is located, this is my country, in West Africa. We are a little country between the equator and the Tropic of Cancer. And the Ministry of Health National Security Action Plan prioritized the tackling AMR using a One Health approach, which has not been applied in practice in the country. Because as I said, AMR is not only a problem of medicals, doctors in hospitals. It's the One Health approach that can lead to better and reliable success, implicated the Ministry of Agriculture, the Ministry of Environment, the Ministry of Health, the Ministry of Higher Education, everybody in the same vision. And very few institutions are involved in AMR monitoring in Benin. Now, we are coming to my research unit, which mission was to conduct cutting-edge basic biomedical and public health research relevant to the needs of population. This is the research unit in applied microbiology and pharmacology of natural substances at the University of Abomey-calavi. Here is my research unit, and we did a lot of work related to AMR, especially isolation of pathogenic microbes from different matrices, water, soil, hospital, communities, and we perform phenotypic and molecular characterization. We look for resistance genes, virulence genes, and especially on alternative to antibiotics based on medicinal plants, based on phages, and based on probiotics. And we also work on capacity building in the field of AMR. some of the data we released about AMR in Benin, you know, we did some research from environmental and catheter samples. When you go to hospital facility, we collect the environmental and catheter sample in those hospitals, and we find some resistance to beta-lactams, fluoroquinolone, aminoglycosid, and macrolide. And it was very serious threat to know that in hospital we can have those kind of resistant bacteria. That means if something is not done quickly, then this resistance will be transferred to the patient that will come back to their house with those bacteria resistance to antibiotics. So we also collect some urines and cervicovaginal secretion from pregnant women, and we detect even VIM2 genes, which is a very specific gene, a very recent gene in Africa, and we find it among our targets. We also work with chicken meat, where we found some strain of Campylobacter resistant to many bacteria, many antibiotics. We also work on urine samples and foods, kitchen sample. We work in all the components of the life, and we can ensure that AMR is everywhere in Benin, and that is not very interesting. So our lab is involved in an international project about AMR. We are conducting a project now with Erasmus Plus, which will strengthen expertise in bioinformatics to fight against antimicrobial resistance in West Africa. This is very recent. Capacity building, antimicrobial resistance, and bioinformatics. We're also working with the Ministry for Foreign Affairs in Finland, working to improve the laboratory testing, because the answer should come by there. We still lack from guidelines in Benin. You know, we have many hospitals, and in each lab hospital, you will find a different way to perform antibiogram, for example. But we need to have a same algorithm that we can have data that could be interpreted and give some answer. So here we have capacity building, detection of antibacterial resistance, and also detection of bloodstream infection, how to reinforce the capacity of the lab technician. Finally, another project is to track the antibiotic chemical and antibiotic resistance genes in drinking water for quality life. This project is a collaboration with Nigeria, and we also improve the water quality by this way. So a total of 3,040 samples of animal and human origin has been processed the last two years, with a very numerous number of bacteria strain. And we study mostly the gram-positive and gram-negative bacteria. We detect many multi-drug resistance, the BLA and the MEC-A, which are genes very dangerous to know. And this is a very good, a very big handicap for fight against bacterial infection in Benin. So how could we improve the situation? By capacity building, by reference centers, by improving the awareness of the use of antibiotics, to strengthen the AMR research laboratory and find alternatives to antibiotic, and especially take into account One Health approach. And all this is only possible through big collaborative grants. And that's why we thank all the society working with us to fill the national gap related to AMR, to consolidate our knowledge and activities, and finally defeat AMR and save life. Thank you very much.
Thank you, Victorien. That was an amazing presentation, and you had to do it in a bit of a quicker time frame. Thanks for that. I will need to wrap up the session, but I guess I have a question for you guys, and it's a question for everyone that is watching. What is the one message you would like to someone that is watching to take with them when they leave the session? The one important thing that they need to remember, let's say. Hui-min, do you want to go first?
Thanks, Eleni. I think as I have stressed in the last few slides, yeah, I mean, we do not need to know, the difficult processes, these scientific processes of how antibiotic resistance occurs. But I would like, the take-home message from the audience here is like to really let people know, as I said just now, like whoever you meet today, let them know, like antibiotics are like, they are our precious resources. They're like trees, they're like water. If we do not take care, to prudently use them, we might lose them one day, and we do not want that to happen, because I think without antibiotics, as I mentioned just now, a lot of things that the ease of life that we enjoy today will be gone. So yeah, my message would be like, yeah, please do remember, when you see, when you see antibiotics, right, remember that that's a precious resource, right? Tell someone when you can, like, oh, I've attended this talk, and antibiotic resistance, we have COVID now, but antibiotic resistance might be the next pandemic, right? I'll like to the audience to be able to remember this message and to help us stress this to whoever they meet. Yeah.
Mm-hmm. And Victorien, what about you?
Yeah, I would say save our lives, because antibiotics, it's not some sweeties. It's something very precious. You need to refer to antibiotics when you get a result from your lab technician or your doctor saying that you are ill, and they know what is the causes of your disease. So do not take antibiotics just when you have headache, when you feel bad. You need to use it rationally, because each people in this earth, our future depend on how you are using your own antibiotics, even if you are in your room alone. Thank you.
Yeah, very nice messages. And I guess for me, a very striking thing that stayed with me is if you are taking antibiotics and you are advised by your doctor to take antibiotics, antivirals, please do take them as per your doctor's prescription. Make sure you take them until the full course. Do not stop the treatment in the middle. Take everything, because that's how another way that antimicrobial resistance is built, when you kind of not take them as prescribed. So yeah, please do make sure you take your antibiotics. Do not share them with everyone. Share about antimicrobial resistance with your colleagues. And yeah, just spread the world around. Thank you, Victorien and Hui-min, for joining us today. I will have to say goodbye to you and admit the new speakers, but happy International Microorganism Day whenever you are, and good luck with your research.
Thank you very much. Thank you.
Bye, guys.
Bye-bye. Bye-bye.